Hi everyone, this is Dr. Rashid, and I'm here to show you what we are offering for MRCS Part B. I'm from Kung Medics, and we are offering an amazing course for all those who are preparing for MRCS Part B. I want to just walk you through and give you a brief overview of our course so that you are aware of what you are going to get. So when you enroll into our course, you will find that it's available under My Courses. You click on My Courses and you'll find this tab, MRCS Part B full course. The course, all the course is structured beautifully. You can see there's a section for the general guidance. There is a section for the forums, Royal College of Surgeons exam forums, and there is a tab or the tile for MRCSB class, WhatsApp group announcement, and knowledge BCA and skills BCA. I'll tell you briefly about those components. Now, if you click on the general guides, you will get all the PDF available on the Royal College website for your guidance. But we have organized them for you easy access so that you can go through them. When you click on any of this, it will open the file that you can download if you want, and you can read online as well. So, say for example, if you want to simply go through the candidate instructions and the guidance notes for MRCS Part B, you click on this, it will open the PDF for you, and you can go through to understand the structure of this. Here you can see your OSCE exam, and it is divided into two BCAs, the broad content areas. And then those broad content areas are further divided into into multiple different sections. In those BCAs, you will be tested for the knowledge. Your knowledge will be tested, or your skills will be tested. To make it easy, we have organized our course into two BCAs. I will talk about them later. Let's go through the other components. The candidate guide to MRCS exam. These are the guidelines, current guidelines. If you want to go them, click through them. Similarly, MRCS Part B standards, you will find what are the settings in your exam. This is the section about the general guidance. Then is Royal College of Surgeons exam forums. These are five different forums. Four different forums are for the Royal College of Surgeons. Based on your college, you can simply join the forum and start the discussion if you want. And here you can add your notes. You can share your ideas, your difficulty, your questions, anything like if you want to discuss any topic that has been tested in the past. This is the forum for Royal College of Surgeons of England. This is the forum for the Royal College of Surgeons of Edinburgh, and this one is for Ireland, and this one is for Glasgow. Now there is a shared forum for all the specialty forums from different Royal Colleges where you can discuss anything of common interest from different colleges. Now, if you come to those tabs, this is the class tab, and this is a WhatsApp group. So anyone who is enrolled, they will have access to this, and they can discuss any question. They can post any concerns, and they can ask any question from the peers as well. If we have any announcement, normally it will be posted here. When you click on that, you will get the to the news or any announcement. This MRCS B classes, this is actually a Zoom link where if you click on this, you will be taken to the Zoom meeting. Now, we do the online teaching as well as we do offer this for the access to those who just want to read the notes. So during our sessions, we normally use this link. You do not need to wait for any link to come. You do not need to have any passcode or anything. You simply click on this after logging into your course. You click on this and it will take you to the meeting. You can simply join the meeting from your portal. This is a beautiful LMS that we are using. Now, as you all know, that your MRCS Part B is actually divided into two different components, like Knowledge BCA and the Skills BCA. Knowledge BCA is further divided into three different components. Applied surgical anatomy, there will be three stations. Then applied surgical pathology, there will be two stations. And it can be from the pathology purely or microbiology. And there will be three stations from applied surgical sciences and the critical care. This is just a brief description, and we have added those all those sections that cover your knowledge BCA, knowledge broad content area. Here you find applied surgical anatomy, and there's a mention of how many stations will come from this section. If you click on this, you'll get the access to upper limb, lower limb anatomy, thorax anatomy, abdominal pathology, abdominal anatomy, and the pelvic anatomy, head and neck. These are the notes and here pictures. In this section, you will get the access to all the pathological, surgical pathology, and the microbiology stations and the notes. They are organized. You can set them by topic if you want to search, or you can simply go through all of them one by one, because essentially you will need to do all of them, and they are arranged alphabetically. From what starts from A, what starts with B and C, so you can go through all of them alphabetically. Now, going back to knowledge BCA is applied surgical science and the critical care. There will be three stations, and those stations are like interpretation of the data, visual, and laboratory. And there will be interpretation of the clinical data, and there will be the clinical critical care management station. So if you click on that, you will get access to all those topics which are normally tested in your exam. This is about the knowledge BCA. Now let's go to the skills BCA. Here, skills BCA. If you click here in the introduction part, you will see how many stations are coming from the physical examinations and the procedures. So you have three different types of the skills, which are further subdivided into different types: the physical examination, the procedural skills, and the communication skills. So these are three different types of skills, and there will be nine stations out of 17 in your exam. So three physical examination skills station, two procedural surgical skills stations, and there will be four communication skills stations. And out of those four, there will be two history taking stations, and there will be two stations from his information giving and information receiving. And when you come to this section, essentially they are for the we have added the notes according to them, which are high yield and high standard notes, and they are according to the need of your exam. And we mentioned how important they are. In few section you will get only one station, in some section you'll get two or more than two stations. So according to that, you can gauge your time, the amount of the time that you want to put in, and the amount of energy that you want to put in for those sections. This is a beautifully arranged and organized course, and I can guarantee there is no other course using such a beautiful LMS. And we will be adding all the videos and recorded videos along with this, so that you can watch them when you get the chance, because I know that you are all busy in your clinical practice and surgical practice. And If you have any question, you can ask us anytime. This is what I wanted to show you, and we will be conducting more sessions as well as a pay. Now, we are based in Manchester, and the good news for those who are living in the UK, they can also access the academy. They can come and they will be able to join our additional OSCE sessions, including the skill stations like the surgical and procedures, venipuncture, IV cannulation, catheterization, male and female breast examination. We have multiple dummies that are normally used in the exams, like the mannequins. So you will be able to just in the practical stations section and mock exam for the MRCS Part B. So this was a brief video for you all. If you are interested, please do not hesitate to contact us via email or reach us through the WhatsApp so that we can address your questions and queries. And feel free to join us anytime. And I can guarantee that you will never be disappointed. Thank you.